December is HIV Awareness Month, and this morning, there's new data on a vaccine.
Yeah, so here to break down what this all means for the future of an HIV vaccine is our 9 News health expert, Dr. Payal Kohli. Dr. Kohli, thanks for being with us.
Good morning.
So first of all, let's talk about the fact that HIV, no longer an epidemic like we experienced in the 80s, still very much a reality for a lot of people, though.
Very much so. We're still seeing, over 30,000 infections a year. We've had 40 million people die from HIV. So the idea that here in 2023, decades after we first identified HIV as a virus, we don't have a vaccine or really an effective way to prevent it is really a scientific challenge that I think the medical community really wants to surmount.
Yeah, absolutely. Can you tell us more about the oral options to reduce HIV, like transmission and exposure? I know there's a couple for kind of pre and post.
Yes, we've made great progress with this because,
truly.
we know HIV is transmitted through sex, transmitted through blood products, and transmitted through sharing needles. And even though we don't have a vaccine to sort of get your immune system ready to fight it, we have medications that you could take, as you said, Erica, before exposure, or maybe even as damage control after exposure. So if you take it before exposure, it's called PrEP, pre-exposure prophylaxis. And these are antiviral medicines. And they really honestly work well if you've taken them at least 1 to 3 weeks before exposure, so that the blood levels of the medication have built up. That way, even if any HIV gets into your body, it'll sort of kill it off right away, basically prevent it from infecting your cells where it can then rapidly divide. Now, there are ways that you can take the pre-exposure prophylaxis as needed. So some people might say, I don't have high-risk behaviors all the time, but I want to use the medication just when I'm doing something that might be high risk. You can sort of plan for that and take it a day before and then a few days after as well.
And yeah, I was gonna say, we've seen these medications be game changers when it comes to anybody who has been exposed to HIV. Kind of, HIV, let's be honest, it used to be a death sentence back in the 80s. Now you can tell people you can go live your life as long as you are taking what you need to.
So true. I mean, it's a chronic illness now, much like hypertension or diabetes. It's not a death sentence. We have ways to treat it. But the important thing is that we're talking about it.
Yes.
And the important thing is that we recognize that anyone can get HIV.
Yeah.
It doesn't have a sexual orientation, a gender, a race, or anything like that. It can really be anyone that can get it. So don't think that you're not at risk for HIV just because of who you are, because really anyone can get it.
Let's talk about something that maybe not everybody is aware of, and that's the fact that there was actually a vaccine trial that was happening in Africa. It was stopped early, but I'm not exactly sure why that is.
I wish I could say that it had been stopped early because it worked so well, but it was actually the opposite. It was stopped early for futility of the HIV vaccine. So this was about 1,500 people who had high-risk HIV behaviors, and interestingly, mostly women. About 87% were women. And they gave them 2 different types of HIV vaccines, which are DNA and protein vaccines, along with some of the oral regimens, to really try to understand what is the best way for us to think about reducing HIV transmission. And then the Data Safety Committee that looks at the data said that it's not working, and it's really time to pull it.
What does that mean for maybe some progress with a vaccine for folks?
A huge setback, unfortunately. And in the scientific community, we're sort of a little bit stuck when it comes to HIV. We haven't been able to design an effective vaccine. There's been over 250 vaccine trials so far. Only one that showed a little bit of promise, but even that, the efficacy was around 30%, and then it fell off quickly. So we're not getting an HIV vaccine before 2030 for sure. But what we're thinking is some of the stuff we learned from COVID, like the mRNA vaccines, the messenger RNA vaccines, could we try that in HIV? We know that HIV has a lot of subtypes. It's a scientific challenge because it also mutates. It can mask itself, so you don't see the proteins as well as you saw the COVID proteins. But I'm hopeful that with more funding, we will work on getting a vaccine.
We're actually out of time, but I want to ask this a question because it's important. I apologize to our wonderful producer, Amanda. Who would you say should be taking some of this preventive medication that we talked about?
Every single person that might be at risk for contracting HIV. So it doesn't matter if it's because of your sexual behaviors, because of your sexual orientation, because of your sharing needles, anyone who might be at risk. And if you don't know if you're at risk, talk to your doctor about it. If you get exposed to somebody or have intercourse with someone who might be positive, as soon as possible afterwards, if you can start that post-exposure prophylaxis, these are the most effective ways to protect yourself and still maintain the lifestyle that you want.
I appreciate that. Thank you for answering that question. Thank you, Dr.
Thank you so much.
All right, let's get you.